I just want to continue by sharing with us a bit about fear, anxiety, and depression. So I'm just going to share a bit about fear, anxiety, and depression in the next hour. Again, fear, anxiety, and depression are a very big topic. So what I'm doing is just skimming on the surface and just sharing with you some of the important points about fear, anxiety, and depression. So hopefully in the next 60 minutes, I'm able to share with you what fear, anxiety, and depression is all about, and what do you do when you have fear, anxiety, and depression, and why Christians, a lot of times, when we experience fear, anxiety, and depression, we have actually an existential crisis. One of the motivations why I started writing the book is because I noticed that from my years of practice as a child and adolescent and family psychiatrist, Christians particularly have a struggle when it comes to mental health. And a lot of times, Christians have the struggle because I think Christians, from my observation, feel very stigmatized, and there's a lot of shame associated with that. But I've also noticed that a lot of Christians who have mental health issues, they don't actually get I would say, the proper treatment as they deserve. Because a lot of Christians, we have a Christian worldviews, and it is through our belief in God, and it is through our spiritual belief that we look at the world. And yet, when a Christian person has a fear problem, an anxiety or depression, when they go and see a non-Christian counselors or psychologists and psychiatrists, they don't get a lot of understanding. So traditionally, for example, a lot of people, psychiatrists who are into analysis would say that religion is a form of dependency. So as a result of that, some practitioners would tolerate, others might not tolerate a person with any Christian belief. So that prompted me to write the book and to sort of share that there's something that my colleagues should actually change in terms of looking at Christians with mental health issues, because for a lot of Christians, when it comes to mental health issues, it's actually what I would call an existential crisis. Why? Because we read in the Bible that Jesus said that I've come that you may have an abundant life. So when we have a problem with mental health issues, then we feel so ashamed because it feels as though we don't have an abundant life. And sometimes we Christians ourselves within the body of Christ, we may not be the most sympathetic towards those brothers and sisters who have mental health issues. We just feel that, well, they just need to fast a bit more, pray a bit more, come to church a bit more, and trust God a bit more. But believe me, if you have any experience of being depressed or any experience of being anxious, it's not that you don't want to trust God, it's not that you don't want to pray, but indeed you actually struggle with that. And it's easy for those of us who don't have that problem, just say, well, you just have to trust a bit more. So I hope that out of today, then we will change as believers and as a family of God's children to be able to support one another with mental health issues. So again, what I have to share with you is actually from my book as well, which I try to summarize in the next 60 minutes. So without further ado, I actually want to talk about the core features of fear, anxiety, and depression. When I started my specialty in psychiatry, this is some years ago now, although it wasn't too long ago, I remember that the professor of psychiatry used to tell us, who were what we call registrars then, meaning specialists in training, and the professor said something like this: If you have a choice of having a mental health issues, right, a mental health problems between schizophrenia or depression, right, choose depression because depression is time limited. Schizophrenia is lifelong. So that was the prevailing teaching then, that depression only lasts for about 9 months to a year the most. And why do we ask people to take antidepressant then? Just to improve their quality of life. So the prevailing thought at that time was that depression would actually get better. And taking medication is just to improve so that you don't have the agony. Eventually you get better. Whereas with schizophrenia, you have what we call chronic relapsing. In other words, you get better, what we call in remission, and then you get worse. And the same idea held true as well of anxiety. Anxiety gets better. But many years later, after I become a practitioner, I find that that is far from the truth. A lot of us, if we are honest with ourselves, I mean our colleagues, my colleagues, a lot of us, after you've been in practice for a long time, you do actually collect a number of patients who have chronic fear, who have chronic anxiety, who have chronic depression. No matter what you do, it's not that they are non-compliant to medication, they continue to take their medication, and it's not that they don't attend counseling, they continue to attend counseling, and a lot of them do struggle with that. So that helps us to be a bit more sympathetic towards those people who have chronic anxiety and chronic depression. So let's look at fear. The definition of fear is an intense and immediate emotional response to an actual threat or danger. So in other words, fear usually has an object. So for example, you have a fear of spider, and you have a fear of lizard, you have a fear of bird. Now, for those of you who don't have all these problems like, oh, look, you know, and you think, oh, I can't think of anyone who has a fear of bird. There are people who actually have a fear of bird, okay? And obviously there are some animals that most of us are fearful of, okay? So in this company here, I'm pretty sure that all of us have a fear of tiger and grizzly bear, okay, and shark, right? And some of us may not have a fear of spider, but that is quite common. But there are people who have a fear of bird. And there are lots of people who have different sort of fear. So when you have to confront a situation or an object of the fear, then you actually breaks out into some kind of a response, or what we call a flight-fight response. So in other words, your body actually produces a lot of adrenaline. Adrenaline is what we call the fight-flight hormones. Why do we call that the fight-flight hormones? Because with the adrenaline, you have increase in heart rate, you have increase in muscle tension, you have increase in respiratory rate, and you have increase in sweatiness, and all these things give you an increase in energy and increase in uptake of oxygen, so that you can either run away, which is a flight, or you fight the object, which is a fight, and some of us freeze. That's why we call that flight, fight, freeze as well. You become frozen. So, but sometimes the threat itself is only a perceived threat. So for those of us who have suffered from panic attack, you can actually identify with this. So when you have a panic attack that comes on, your body reacts as though there's something that you need to get out of. There's some situations that you can have to get out of. So your brain tells you that there is some danger. You don't know what that danger is, you just know that there's some danger. And we call that a panic attack. And that is the reason why a lot of times for the person who suffer from the first panic attack, they usually think that they have a heart attack. Because when you can't breathe, your chest is pounding, your chest is pretty tight because of the muscle tension, you break out into sweat, and you're hyperventilating. Of course, you think about a heart attack. And then they go to the hospital, and then the doctor sometimes examine them, do an ECG, and say, oh, look, you have a panic attack. And after that, whenever the body breaks out into a bit of what we call flight-fight response, the person actually continue to suffer some sort of what we call perceived threat. Perceived means your brain tells you that this is it, even though it is not real. And that is actually quite common. So for people who have a panic attack, eventually they may develop something like what we call agoraphobia. They don't like to go to places with a lot of people. They don't like to go to places, supermarket. They don't like to go to a theater. They don't like to be in a lecture hall like this. And if they go, they usually sit at the back row. Sorry for those of you who have sit in the back row. I've just made the diagnosis, so no, that is just a joke. And they do, a lot of them, they sit at the back row near to the exit so that, you know, when they have a panic attack, they can actually get out, okay? That's a perceived fear. So fear is a real thing. Now, how is fear different from anxiety then? Anxiety is kind of a chronic state of what I call disquiet. It's like every day when you wake up, your body is a bit tense. You feel as though you cannot totally relax. Your thinking is a bit clouded and it's not quite clear. And you feel a bit, the word is angsty. You're not totally relaxed. So it's like your stress level is a bit upregulated. And you feel as though there's going to be some challenge for the day. And when you go and see a psychiatrist like myself, who are very good at asking questions but give very few answers, then he will ask you, what are you stressed about? Then you say, I don't know, I just feel stressed. And I just feel as though, you know, I can't totally relax. Then you might go away with a diagnosis of generalized anxiety disorder. Just means that you're generally anxious. So psychiatrists are a bit like lawyers, you know. We just use terms to describe what you tell us. Then after that, we charge you a lot of money for that. So you have generalized anxiety disorder, right? Or sometimes your anxiety can be actually quite specific. You may have what we call social anxiety disorder, meaning that when you go into a social situation, you start to think that, oh, these people are going to ask me funny questions, and they're going to look at me, they think I'm funny, and I want to say something, but they're going to judge me. They think that, you know, I'm being stupid. I want to crack these jokes to make myself accepted, but nobody would laugh at me because they would think that, oh, look, you know, this guy is just a bit crazy or something. So then you get social anxiety disorders. So there are many, many different types of anxiety disorders. Some of us are a bit preoccupied with perfections, with cleanliness, and we scrub the floor, and we vacuum the carpet many, many times. In Malaysia, you don't have carpet, but you sweep your floorboard many, many times. You take long shower, and then you get the diagnosis of obsessive-compulsive disorder. So there are many different sort of anxiety disorders. So anxiety is kind of a state of generalized emotional distress, and usually there is the absence of real threat or danger. Take obsessive-compulsive disorder, for example. Why do I wash my hands so many times? So there's a part of you that says, Kam Wong, stop washing your hand. You're not a surgeon. You don't have to scrub. You're only a psychiatrist. Then the other side of me say, maybe this time I'm going to catch the germs. Then the other side say, you got to be more rational than that. Maybe it's only 1 in a million chance that you get a germs. Then the other side say, but what if the 1 in a million chance is today? So usually with obsessive-compulsive disorder, there is always the what if. What if today is the day? What if I don't check the car door, okay? What if I don't check the windows that the burglar would come in today? There's a what if and what if. That is obsessive-compulsive disorder. One of the things that Christians fear very much of the obsessive-compulsive disorder is actually blaspheming God. I have come across so many Christians, and when they develop an obsessive compulsive disorder, it's got to do with blasphemy of God. And they go to church, they're afraid that they're going to yell out something. And because of that, they don't actually go to church. Or they are concerned about Christians, right? It's not unusual that they struggle with some intrusive sort of sexual thoughts. And they feel really, really, really shameful and really guilty about that. And because of the nature of the thoughts, they don't even want to talk to the pastor. Just in case the pastor said, oh, you have sinned. Or they don't even want to talk to their elders or their cell group leaders because that is sinful. So as a result of that, they don't actually get help. So obsessive compulsive disorder of sinful intrusive thoughts is very common with Christians. So you have the panic disorder, you have the social anxiety disorder, you have the obsessive compulsive disorder, and then for some of us who have experienced trauma, then we can experience what we call post-traumatic stress disorder. Because when we have a trauma, and it can be dated back to childhood, it can be dated back to many years ago, the trauma actually triggers our body in the brain, okay, in the midbrain, in the area that's got to do with danger, to be hyper alert. And you see, when you have a trauma, you got to be alert. With a trauma, your body has to produce a lot of adrenaline. With a trauma, your body actually have to give you that fight-flight response to fight the trauma or to run away from the trauma. But because the trauma is so big that as a result of that, the trauma center continues to function and it doesn't turn off. And whenever there's some situations that resemble the original trauma, then your body gets into an aroused state and the alarm goes off, beep, 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 and then you have adrenaline coming on and on and on. That is post-traumatic stress disorder. And a lot of times, the post-traumatic stress, the anxiety actually manifests itself in sleep. A lot of people who have what we call PTSD, they don't sleep very well at night. They usually have dreams of being chased by animals or dreams of being attacked. And that is because of the trauma, PTSD. And sometimes trauma can be what we call vicarious. Now, I'm not too sure how many of you remember 9/11. Were you born yet when there was 9/11? I still remember 9/11. I was at home. Now you remember. That's good. You don't have PTSD. And I still remember. Why? Because when I turn on the TV, it's like, oh, that is incredulous. Is this some joke or something from Hollywood? You know, they're just having me out. I still remember what I did. Why? Because the emotion is so intense that you remember the content. So whenever we have a memory with very intense emotion, it is very hard to erase that memory, and then it becomes a PTSD. So that is anxiety. Depression, on the other hand, is a state of despair or sadness in response to actual or perceived loss. Now, contrast that with anxiety. Anxiety has to do with uncertainty. I'm not too sure that this time around my hands could be contaminated. I'm not too sure that in a social situation, when I say something silly, somebody is going to judge me. I'm not too sure that at this moment, the loud noises that I hear has got to do with an explosion, that is PTSD. I'm not too sure that on this occasion, when I get exposed to this something, it's going to cause me harm. Anxiety got to do with uncertainty. Depressions got to do with losses, perceived or actual losses. One of the person who experienced profound depression is Job in the Bible. It's Job in the Bible. He had what we call a lot of life events of losses. And as a result of that, he plunged into a depression. When you look at Job, it's actually very interesting because his friends were trying to help him when he was depressed. Initially, his friends actually did quite well. We read in Job. I'm actually wanting to write a book on Job as well, following this one on anxiety. Initially, the friends were quite okay. They share his pain together. And after a while, then his friends then start to get him a solution, right? And the solution is like, oh, maybe Job, you have sinned. And, or maybe Job, you have done this. And Job said, no, I haven't done it. And Job said, look, I actually want to talk to God about this. How dare you talk to God about this, you are the one that is wrong. And in a lot of ways, when you look at Job and his friends especially, and I have to humbly say this, because I include myself as part of the family of God, and a lot of times this is how we behave as a community of brothers and sisters towards somebody who has depression. We start to find a solution for them, and yet the right thing to do when somebody is depressed is actually to journey with that person. So Job has a lot of losses, and that's why he tried to go back to God to find an answer why he suffered those crises in his life. So depression has to do with a response of an actual or perceived loss. So what do all these disorders have in common? All these disorders have in common in what we call the bio-psychosocial disorders. Now, what do I mean by a bio-psychosocial disorders? I'm sorry if, today you get exposed to all these terms. Okay, it takes a psychiatrist many, many years of study, to learn all these things. And here we're doing a kind of like Psychiatry 101 in 1 hour. And it's called a bio-psychosocial disorder because when you go and see a psychiatrist, and if the person diagnoses you they have fear, if the psychiatrist diagnoses you they have an anxiety disorder or depression, the person then considers 3 dimensions in your life: the biological dimension, the psychological dimension, and the social dimension, and then come to some kind of an understanding of why you are fearful, or why you become anxious, or why you become depressed. So that is what we call a bio-psychosocial disorder. Now let me give you an example. So what is a bio-psychosocial disorder then? It is actually a convergent point of all the 3 factors, of biological factors, of psychological and social factors. So let me elaborate a bit further, and that is the reason why mental health is very different from physical health. So without scaring any one of you, okay? So if you say that, oh, I have a COVID, right? What you're actually saying is that, you go for, what test is it again today do? I forgot. I must be traumatized, I forgot. You know the one they stick that thing into your nose and... Yeah, but there's a name for that. PCR, yeah, okay? So they isolate the genetic sequence of the COVID virus, right? So if you have a cold, if you have an influenza, right? And your virus is the same as the other person's virus. If you have COVID, your COVID is the same as the other person's COVID. It's just that yours is found in your nostrils and the other person is found in his nostrils. So physical disorders have a common, what we call pathogen or common cause of common factor. Whereas in mental health issues, even those 2 people receive the same term of depression, they actually suffer from quite different things. Why? What do I mean by that? Now, if you sort of try to understand bio-psychosocial, okay? So one person who have a depression or anxiety has different biological, psychological, and social factors. Another person has the same term. The psychiatrist will still say, well, he has a generalized anxiety disorder, have this different biological, psychological, and social factor. So let's take depression. Some people, if they come from a family with mom and dad who are depressed, grandparents who are depressed, they have very high what we call biological factors. And they have fewer in the way of psychological factors. And then maybe one or two social factors like being isolated, and then they become. Whereas another person may come from a family where mom and dad are not depressed. No one in the family is depressed. But then they come from a very deprived, kind of difficult childhood, and so much so that they actually suffer childhood trauma. Then they can become depressed. So no two people who have the same term or disorder have the same bio-psychosocial factors. Do you get it? So once you grasp that, then you would understand what a mental health problem is. So a mental health problem is actually a convergent point of the three factors of biological, psychological, and social factors together. So because of that, that's why when you see a psychiatrist with the same sort of things like depression, you may get different form of treatment. You may get a bit of medication, but then he may say, look, you know, we really have to look into your childhood issues and let's talk about your childhood issues. Another person may get the same antidepressant, but then the therapy would actually be quite different. And that is the reason why, would you believe that there are actually many different types of psychological therapy existing in the world today. Guess how many? Have a guess. 1, 2, 3, 4. A few hundreds. There are a few hundred types of psychological therapy. In my book, I say that understanding human being is a bit like the 6 blind men. Have you read that story before? Right? You have 6 blind men, and then they try to appreciate what an elephant is, right? So one person felt or feel the ears and said, oh yeah, elephant is like a big fan. The other person touched the legs and said, oh, elephant is actually like a big tree because it's like a trunk. Another person touched the body and said, oh, elephant is actually like a big wall. Another person touched the tails and said, elephant is actually like a big snake. So therapy is a bit like that. So the therapist help you to understand according to his way of understanding, or what we call formulation of why you get anxious and why you get depressed. Now, knowing that makes me feel like a more humble therapist. Which also means that if you want to see a therapist, it's always good for you to ask the person and say, can you explain to me why I am depressed? Can you explain to me why I am anxious? Because getting the term depression and anxiety is one thing, but knowing why you are anxious and depressed is another thing. Because unless he understands, according to his understanding, or his framework of why you are, then he can't treat you. And after all, you are the person that is paying the money. And that is the reason why you have to ask the understanding. Take anxiety, for example. If you were to see a therapist for your anxiety, basically the therapist then have 2 choices to view your anxiety. A therapist may say that, Kam Wong, that's terrible. You are anxious. It's a bad thing. It's a negative feeling. Let me help you to get rid of that. Let me help you to get rid of that. Let me help you to get rid of that anxiety. So, because anxiety is actually a bad things of bad emotion. So the person may say, Kam Wong, you feeling anxious because you think anxious thoughts. You think anxious thoughts, you feel anxious. So he's going to teach you what they call DBT. Yeah, no. CBT, sorry. Even I get confused. Okay. So he's going to teach you CBT. It's very common, right? Cognitive behavioral therapy. And you feel anxious because you feel anxious, you behave anxious because of your thinking. So he's going to help you to challenge, right? So if I walk into a room, I have this social anxiety, then I have to challenge myself and say, what is the evidence that you guys are having these negative thoughts about me that, I'm not talking right? No evidence. I haven't even gone into your brain. I'm not God. I can read your mind. So DBT say that, well, I just have to think non-anxious thoughts. And so what if you think about me being stupid, right? Or acting in a strange way? Then I don't feel anxious. There's another one called ACT. It's not Australian Capital Territory. It's called Acceptance Commitment Therapy. So acceptance commitment therapy, which I like better, actually says that don't worry about the anxious feeling. The anxious feeling, okay, is just pointing to something. What you need to do, right, is to embrace your anxiety, learn to tolerate that, and then think about what is very important for you. So I go into a social situation, I go for my interview for a job, and I feel anxious, I embrace that, and then I say to myself, well, I have to learn to get through this because I need the job. So that is ACT. Or the other one is DBT, dialectical behavioral therapy, which is like, again, is like tolerating that anxiety and then using ways to cope with things and then using ways to advance so that I can get on top of the anxiety. So different therapists are going to help you in different ways depending on his or her own understanding of why you feel anxious and why you feel depressed. And that's why there are so many therapists around and there's so many schools of different treatment for anxiety and depression. So the important thing that you have to do or your loved one have to do is if you are besieged, if you are struggling, okay, always talk to your doctor, always talk to your therapist and say, what do you think? And you have to agree and you have to feel comfortable with your therapist. Otherwise, it's pointless seeing him, and it is within your right to know how he or she is going to treat you. So that is the bio-psychosocial approach. So they are also treated in a bio-psychosocial kind of way, right? So we use medication for the biological bit, and sometimes I think in Malaysia you might still use like electroconvulsive therapy or ECT, but these days in Western country we use something called TMS, transmagnetic stimulation, which got to do with magnet, and it doesn't actually put the person through electroconvulsive therapy, and supplements. So there are some supplements that are found to be quite efficacious in treatment of depression, for example. People with fish oil and vitamin B and also folic acid. So there are some of them that actually help, and also St. John's wort, okay, that helps with the medication. And then psychological therapy that I talked to you about, the CBT, the DBT, and the ACT. And we can treat a person by one-to-one, and a lot of times we also treat couple or family therapy, social support, and milieu therapy. Now, when you look at the bio-psychosocial model, I just want to stress that social support. This is where the church is important as well. Because when a person is suffering from an anxiety or depression, we need to have a body of believers coming together to support that person, to help that person, to do prayer, to actually help the person through the crisis as well. So healing has to take place within a community. So that is the bio-psychosocial approach. So I just want to ask the question, what is the role of the church in all these things? Because the church is supposed to be a healing community, and the church, we are supposed to come together to support one another and to help the other person through their mental health issues. Let's go back to the first talk. Mental health is a state of well-being where each individual is supposed to realize his or her potential, able to deal with the stresses of life, being productive in his or her life, and contribute to the community. So as a church, when we have a brother or sisters who have a mental health issues, right? The person usually cannot realize his or her own potential, either because the person is sick or the person have to take a lesser role. Then the person cannot deal with the stresses of life, and the person cannot be productive and contribute to the community. So this is where we actually come in. And this actually is part of what I call Christian spirituality that is expressed through the community. And I think that is very important. And I think that element of community life, spirituality through community life, is something that is so unique in our Christian faith. These days, there are lots more spirituality that has been accepted in the mental health circle. But I have to say that Christians, we lag behind. There's a lot more in the way of philosophies from other faiths that has been accepted, but we are lagging behind. These days, it's not uncommon that when there is a World Congress on mental health, you actually have a religious person to do the opening remark, or what we call the keynote speaking. I've yet to see that there is somebody who actually is the keynote speaker from the Christian faith. And I think part of the reason is that I think as a body of believers, we have given that up. And I think we have to reclaim. I think we have to reclaim the ground. Remember Jesus, when he healed the leper, right, what did he do? He told the leper and said, go present yourself to the priest. Why? Because then the priest can pronounce that he no longer has leprosy. He can accept it. Our Christian faith is a very relational kind of faith. It's actually work out, display, is manifested through me living my life with God in that vertical kind of way as my Father, and realizing the importance of his relationship with me. But it's also horizontally through you and I. I can't do it by myself. None of us can do it by ourselves. And yet, the sad thing is this, if I come back to COVID, that after COVID, I think the COVID has divided a lot of the churches. I think there's a lot of fear. And I think that there's also a lot of misunderstanding. And I think it's time that we actually reclaim that. And I think that is very, very important. I think the COVID has also helped us to realize and to re-examine our Christian faith and how it's going to apply to ourselves. I think the COVID and what, at least that is for me, and that's what prompted me to write the book as well, of the centrality of Christian spirituality in our life, especially in mental health. How am I going to express that? And how am I going to distill the important things of my belief system, and not so much a religious kind of way, but in a very spiritual sort of way? And that's what prompted me to write the book. I wrote the book, there's part one of the book, looking at some of these things that I've just talked to you about. And then there's a part two of the book, which is more like a self-help manual. 6 steps to getting freedom from fear and anxiety through the expression of our Christian spirituality. I look at anxiety and fear quite differently. I tend to use the paradigm that when we have anxiety and fear, we have to learn to see beyond that and help to anchor ourselves in the midst of the fear and anxiety, and applying some of our Christian spiritual belief in order to gain freedom from that. And I think there is something so unique about Christian spirituality. And the uniqueness of Christian spirituality is this. Christian spirituality and the Christian faith is a very relational faith. And I think that's what marks Christianity, apart from all the other faiths. It is just not a set of principles. It's actually life itself. It's actually life itself. If you were to ask me, I'm a therapist, and you ask me, Kam Wong, seeing that there are 400 schools of psychotherapy around, what sort of psychotherapist are you? Psychotherapist just means that you use talking therapy to help other people. Well, I would say that I'm more like a Christian existential therapist. I think God has given us our spiritual belief, and God has given us Jesus, right, to show us what it means to live as He wants us to live, as sons and daughters. So Christian spirituality is not just a set of principles, but is by and large a relational thing. When I ponder upon how we have actually expressed ourselves, I told my wife that I think we are very good at looking at Christianity, a lot of us, in what we call a transactional faith. A transactional faith means that we exercise our faith in such a way that by faith, then certain things will happen. I think there's an element of our Christian spirituality, or what I call a relational faith, that is seldom explored. And a relational faith is actually expressing my faith through relationship with God the Father, vertically, and as a result of that, with each other horizontally. I remember when I was a kid, I came from a non-Christian family, like a lot of us, and like a lot of Chinese people. my parents believe in a lot of gods. I still remember as a child that I used to accompany my mom to the temple. And I see transactional faith being practiced. And a lot of religions have what we call transactional faith, is that if I do this to the deity, if I do this, and then something would happen. And I think when we can exercise Christianity in such a way as a transactional faith, kind of, if I exercise my faith, then this will happen. But I think there's an element of what I call relational faith that is seldom explored. If you don't believe me, you go and read Hebrews chapter 11. Hebrews chapter 11, we actually talk a lot about, for those of us who talk about faith, right? We usually look at the first few verses. Faith is the substance of things hoped for, the evidence of things not seen. But then when you read Hebrews 11, towards the second part of Hebrews 11, it's almost like all those people, their transactional faith didn't work out, you know. They were crucified and something happened to them, you know, they died. And I think that is the element of transactional faith, and that is our relationship in such a way that helps us to carry us through. So when I write about Christian spirituality and mental health, I look at that, the transactional, the relational faith, the sort of discovery, the sort of examinations of our relationship with God the Father. And everything that we do, my wife and I, we are involved in inner healing. We pray for people, we help them, we talk about cutting soul ties, we do renunciation, forgiveness. All those things lead to a final point, and that is our relationship with Abba Father. And I just want to end so that we can go for afternoon tea, and then we can go into the third session. Okay?